in-house doctor, Dr. Gyedu Owusu, who is also our board chair, is the one who evaluates the lab and scan results and prescribe medications for the women and couples. Through these arrangements, over 47 women have reached out to us. 20 have been treated, with some still on treatment. They presented to us various issues, including PCOS, that is polycystic ovarian syndrome, hormonal imbalance, infertility, and secondary infertility. I am thrilled to share with you the inspiring story of one 38-year-old woman who reported to Xoese Ghana with a case of no menstruation for 3 years. So this woman for the past 3 years has not menstruated. She tells me January 2025 will be her 10th marriage anniversary, but nothing to show for, and she's very, very depressed. So she came to us and then she gave up all hope because the amounts being quoted at the various hospitals for her to resume menstruation again were very high. However, when she came to us, she did a preliminary test and scans needed at a discount because of our partnership deals with the partners, the fertility facilities. And in less than 3 months, she has started menstruating again. All of these, thank you. All of these women are receiving the needed help and treatment with a goal to attain pregnancy. It is my prayer and my hope that all the results to get pregnant will be achieved. So our women in general, when you feel sick in your abdomen, go to the hospital. When someone tells you, oh, this is normal, don't go anywhere, it happened to me some time ago and I use this medication, please don't listen to that advice. Don't listen to that advice at all. You need to seek professional medical consultation to ascertain the cause of that pain and treat it. There are also fertility tests you can do to check your status. Why is it necessary? If you fail to do these checks now, only for you to get married, and then the time you are expecting to get pregnant is delaying, pressure mounts on you. We know how adversely stress can affect our chances to get pregnant. Our partnership deals make it possible for you to get discounts on tests including semen analysis, hormonal profile, pelvic scan, transvaginal scan, IVF, IUI, and others needed for fertility treatment. I will urge all women and couples needing these services to contact me after the conference. Once again, I call for an end to infertility stigma, particularly against women. Infertility is a shared responsibility between the male and female. Therefore, it can never be said to be the woman's soul's fault all the time. Research has said that men are responsible for 45% of infertility as well as women, while the 10% is to be blamed on environmental factors. I get disheartened when I see a woman being made subject of infertility stigma when they should rather be supported. Just yesterday, I had a chat with one lady. She told me she's been married for 4 years now, no child. And I asked her, have you been to the hospital? She told me no. What about your husband? Has he been to the hospital? She said no. My husband says he's tired of the marriage and he wants to divorce me. And I asked, why would your husband even take such a dire decision without first going to the hospitals to find out what the cause of the infertility is? And who even tells him that he is not the cause, or who tells him that the woman is the cause? This shouldn't be the way it should go. Before you even take a decision to divorce your husband or your wife, you should first go to the hospital. For 4 years, not the man, not the woman has been to the hospital, and this is not what we want to have. So this woman will be assisted by Xoese Ghana. We are in talk with her, and then she'll be visiting us by next week. To newly married couples, don't feel pressured by anyone. Seek medical help if after 1 year, your desire to have a child is not met. To our mothers, fathers, mothers-in-law, sisters-in-law, please be patient when there is a delay. Be supportive and kind. Speak consolingly to the women. To the women trying to conceive, don't give up. This journey calls for perseverance, strong will, and patience. Seek to all medical guidance from your doctor. To the men, seek medical assistance together with your wife. Support them if they need the treatment. And avail yourself if you go to the hospital and it happens that you are the one needing the treatment. Avail yourself and be cooperative. Don't feel because I'm the man. No, our doctors are going to throw more light on that. Special thanks go to board members of Xoese Ghana, Mrs. Jessica Adote. She's the Principal Regulatory Officer of the Food and Drug Authority, FDA. Mr. Marek Kai, all the way in Latvia, EU. And then Mrs. Olga Shitiakova, my own boss, all the way in Russia. Niyate of Radio Gadangbe based in London, Dr. James Doko Asante of Unimac, and Mrs. Fisla Asante Kwachi for their immense support in putting this conference together. Not forgetting Nia Shiaku Shika Otu, one of our distant supporters, and my friends and loved ones who made donations towards the fertility conference. Time will not allow me to mention all your names, but I thank all of you. I also express my deep gratitude to Dr. Edem Yaji, the CEO and founder of Leicester Hospital, for the insight you provided at the time the fertility conference was being planned. Thank you, and God richly bless you. Let me take the opportunity to announce that the fertility conference will be an annual event. My sincere thanks go to Kina Pharma Limited, the general manager, Mr. Said Muhammad Shaheen Zafar. He has made available 500 strips of folic acid to be given to everyone present here. Thanks also go to Tovila Water Solution for providing us with water that is being served here at this event, to Accra Fertility Center for giving us the expert specialist, Dr. Joseph Homiah, Institute for Liberty and Policy Innovation, ILAPI, Samuela Ventures, Tema Women's Hospital, IKM Construction, Clarity Specialist Scan, Metropolis Healthcare, and Cornish Clothing for all the support. God richly bless your businesses. Remember, a woman with or without a child is still a woman, a complete woman and a human being, and she deserves respect. She deserves the value that she needs to be accorded to. Her human dignity is intact with or without a child, and she needs to be accorded that respect and value. Please pay utmost attention to the various presentations and feel free to ask all the questions that have been weighing on your mind about fertility. Together, let us end infertility stigma. Xoese Ghana, believe. Thank you.
I believe a lot of you have heard about infertility, right? But then it just goes beyond a woman not being able to conceive. So at this juncture, we are going to take a quick glance at infertility. We are going to take some perspective and dynamics. And to help us do this, let's welcome Dr. Gyedu Owusu, the board chair of Xoese Ghana.
Good evening once again. My name is Dr. Gyedu Owusu. I'm a medical doctor currently at the St. Anthony's Catholic Hospital. Today is a very special day, and whenever I get opportunity to educate people about health-related issues, I take it as a privilege, because one of the problems we face as health professionals is that sometimes our patients come in a state where the condition has been complicated. Because of inadequate health education, they don't know what to do. They resort to other means before they get to the hospital. So by the time they get to the hospital, there is little we can do to help. So when I'm offered the opportunity to educate the public about health-related issues, I'm very elated. Today, we will be talking about fertility. And before we do that, we will first talk about the stages of adolescence, menstruation. We will talk about ovulation, the fertility window within which you can try actively to get pregnant. We'll also take a look at infertility itself, the causes, how we evaluate people with infertility issues, how to enhance fertility, and also the management of people with infertility issues. When we talk about adolescent development, the period of adolescence evolved around three main chronological ages. The fact is that before one can have an issue with infertility in their adulthood, it means that during their adolescence, there was some omission or there was something that the parent didn't take a look at. Most of us here, we are parents. Some of us are yet to give birth. And some of us, or all of us, were adolescents before. And we can attest to the fact that sometimes you complain to your mother about your period, your mother will tell you that, oh, don't worry, that's how mine was. That's how your grandmother's own was. So you'll be fine. You'll be complaining about extreme pain, type of pain that you can't even walk. Your mother will tell you that, oh, I went through the same and I survived. So you bear with it. Get some painkillers, you'll be okay. We forget to send our wards to the hospital for evaluation. And some conditions that could have been averted in their youthful ages tends to be omitted and cause serious problems in their adulthood. So talking about these stages, I would like to throw a little light. I don't know why our projector is a little blurred. I want to throw a little light about the stages of adolescence and what usually happens, so that when you have a ward within these age groups, you'll be able to understand them better and you'll be able to relate well with them. For the blurredness of our slides, let me quickly take my tablet to have a better look at things. All right. Okay, it's much better. So physically, from the age group of 10 to 14 years, you realize that they start to initiate puberty. That is when they start to have vellus hair. In Tree, we say in Kuri, you see some small hair at their beard, some at the around their lips, and they start to develop their genitalia. So you realize that the females will start to have some hairs around their private place. The males will also have the same. Their penis starts becoming large, and cognitive wise, they start to have concrete thinking. When I talk about concrete thinking, they reason based on what they see, what they feel, what they hear. So at this stage, they are easily influenced. So if you are if you're a parent and you have a ward within this age group, this is a time you have to bond well with them, so that they can easily tell you whatever they are going through, and you can also help them with the experience that you have. If you don't have any experience at all, you can link them to someone who can help them at this particular stage, or else they will fall prey to people who will misinform them and misguide them. Emotionally, they become egocentric, and socially, they rely on family or parents. So basically, at this stage, they don't have anything and mostly depend on their parents for survival. They depend on their parents for advice. They itch for peer relationships. They try to get friends of same sex at this stage. So you realize that the ladies will be bonding well with the fellow ladies, the guys will be bonding well with the fellow gents. And there are some few romantic relationships at this stage, 10 to 14 years. Before, some few years ago, this was true. There was few relationships, but currently, it's not few. You can bear witness to the fact that due to the advancement of technology, at the age of 14 years, you realize young people at 14 years will be in romantic relationships. And sexually, they tend to have crushes. If you bond well with your child, you realize that the child can come to you and tell you that, oh, mommy, I have a crush on this person, I have a crush on that person. And you, as a parent, you now have to educate or counsel your adolescent on what he or she is going through and the ways or steps he should follow or she should follow. Between the ages of 15 to 17 years, by this time, physically, they have completed puberty, and they have increasing ability of abstract reasoning and risk consequence deficit. The risk consequence deficit means that they don't know much about the consequences of the actions they take. They take actions without thinking about them. So as a parent, you have to make them aware that, oh, at this stage, you fully developed. You start having feelings. This is what you should do. This is what you shouldn't do. Some people advise that at this particular stage, you should educate your ward sexually and tell them the benefits of using protection. The reason being that currently nowadays it's very difficult to restrict your ward from engaging into sex. So the best thing you can do is educate them on the matter extensively. Show them the best ways to go by things to prevent teenage pregnancy and also to prevent sexually transmitted infections. And you bear witness that within this age group, they will be in the senior high schools, and a lot of things will go on there at the senior high school level. If your work comes out of the senior high school untouched, you are graced. So at this stage, you have to pay much attention to your ward and educate them on sexual behaviors, the effects of their actions, what can happen to them, and what they can benefit if they abstain from them. Emotionally, they develop sense of identity. They take risk and experimentation. You realize that sometimes you advise your ward within this age group, they will not listen. They will go by what they've decided to do until they hit some bad experience, and they can now sit down and realize that the path that they took was wrong. So they become risk takers. They want to explore, they want to experience, they want to have fun, they want to know what goes into this, what goes into that. And social media nowadays is helping with that. So they tend to experience more than you, the adults. And social level, they have peer influence and they start to differentiate from family. So you realize the peer influence comes in many folds. The colleagues will be influencing them by positive ways and by bad ways. Positive as in they form steady partners, they talk about issues. If they are religious, they tend to communicate more about moral matters. And the bad aspect is that they tend to influence each other. So if they have bad friendship, you realize they influence them into that bad companion. Smoking, alcoholism, sexual misbehaviors, having multiple partners at this particular age is so common in our era now. And sexually, as I said earlier, exploration and experimentation. In this age group, they have intense romantic relationships. That is when they tend to come to you that I have a boyfriend, I have a girlfriend. And no matter what you say, you cannot separate them. So let's do them apart. So this age group is very crucial. And you realize if you are able to handle the early stages, that is the 10 to 14 years, the middle stage become very convenient between you and your son or your daughter. They tend to speak to you freely. Whatever they are going through, they talk to you about it. But if you fail in the early stages, then the middle stage becomes very difficult. And the late stage, that is 18 years and older, they become already, they are physically matured, they have abstract reason, and they understand risk and consequences. They understand that if they have unprotected sex, they will get pregnant. They understand that if they have unprotected sex, they will get sexually transmitted infections. They understand that if they get pregnant on the way, they have to drop out of school. Their future will be on hold. At this stage, intimacy as basis for sexual relationships, empathy, and connectedness with others. So they base their relationship mainly on intimacy. Because at this stage, they are grown, 18 years and older. Some get married around 21, 22, 23. So they attract more or pull more towards intimacy as a form of connectiveness related to sexual relation. And exploring new mature role in family. At this point, you involve them in decision making in the family. You try to educate them to take roles. They say charity begins at home. So if you encourage them to take roles in the house, they tend to take up major roles in the society, in their schools, in their churches. And sexually, mature acceptance and enjoyment of sexual self, good communication and decision-making skills regarding sex. One thing I forgot about the middle age group is that they are also very secretive. They are very, very secretive. And if you don't have a great bond with your daughter or your son, there may be things going on that you may never know. Some of you seated here, you may think that, oh, your child is like Holy Mary. But if you take a chance and you go to their schools and you investigate a little further, you realize that Mary Magdalene is even better. So at this stage, they are very, very secretive. And we have to bond well with them for them to show us or tell us whatever they are going through. Let's take the opportunity to talk about the menstrual cycle, because all these fertility problems that we'll be talking about, without ovulation, it becomes difficult to get pregnant. And without ovulation, some will say without ovulation, there is no menstruation. There will be bleeding, but that will not be menstruation. Part of the menstrual cycle, crucial part of it, is ovulation. And I will take that aspect out and we'll talk about it further, since we are dealing with fertility today. And the main parameters relating to menstrual cycle is that when you come to us, as Obs and Gynae doctors, we will inquire further about the frequency of your menstrual cycle. When I talk about frequency, I mean that the number of times you have your periods in a year. In a year, you are supposed to have a total of 12 cycles. So every month, you are supposed to menstruate. If you have fewer than 9, we think of oligomenorrhea, that you are having fewer menstrual cycles. And we also talk about the regularity. Does it come every month? Some of you here, your menses will come this month. In the next 3 months, you will not have your menses. And you are happy because you are not buying parts. It's a problem. You are supposed to have your menses every single month. So we will discuss regularity with you, and we'll also discuss the duration. How long does your period last? So how long do you bleed? Do you bleed for 3 days? Normally, you're supposed to bleed for 3 to 7 days. We will ask you, do you bleed less than 3 days? Do you bleed more than 7 days? That will help us know what is mainly going on. And the volume. We regulate the volume of your menstrual cycle by asking about the number of pads that you use. In a day, how many pads do you change? Do you change more than 3 pads? Are they fully soaked? If they are fully soaked, it means that you are a heavy bleeder. And heavy bleeders, they are always prone to anemia because they lose a lot of blood. And anemia is not a good medical condition to entertain. So when you have such issues of heavy bleeding, you have to definitely see a doctor for further management. As I said earlier, ovulation is a very crucial part of your menstrual cycle, and usually it happens at the 14th day of your menstrual cycle. And you attest to the fact that all of you here, especially the ladies, you don't have the same menstrual cycle. Some of you have 28-day cycle, some have 31, 25, 33, 34. So to get your ovulation, you just subtract 14 days from your menstrual period. So the menstrual period is from the first day of your current menstrual cycle to the first day of your next menstrual cycle. So first, let's say today is 2nd June, your menses is today. Your next menstrual cycle happens on maybe 2nd July. You calculate from today to 2nd July the number of days that is between. That is your period, the period of your menstrual cycle. So let's say you have a 21-day menstrual cycle. It means that if we subtract 14 from 21, your ovulation will be around the 7th day. Please, you understand? If you have a 35 days menstrual cycle, when will your menstruation be? So it will be 35 minus 14, which will be 21. So around your 21st day, that is where your ovulation will be. So you realize that each person has different ovulation day. So it's very important to know your menstrual period so that you know when your ovulation is and when your fertility window will be. If your cycle ranges between 26 and 28 days, your ovulation will happen definitely between the 12th and the 14th day respectively. And when we talk about fertility window, after you get to know your ovulation day, 5 days before your ovulation and 1 day after your ovulation is your fertility window. 5 days because the sperm is known to survive in the vagina for a maximum of 5 days, and the egg is known to survive for 24 hours. So if you have sex 5 days prior to your ovulation, the sperm can survive inside the vagina and wait for the egg till you ovulate. And when you ovulate, the egg will survive for just 24 hours and it will come out. So if you have your fertility window in 6 days, it means that 5 days to your ovulation, you have to have continuous, if not continuous, if you cannot contain it, at least alternate day intense sexual activity if you are serious about getting pregnant. Most of us don't know about this, so they just have sex any other day and they expect to get pregnant. And people miss their fertility window and they'll complain to you that, oh, I've been having sex, but I'm not getting pregnant. You are not having a conscious sex. Conscious sex means that you are aware of your ovulation, you are aware of your fertility window, and you make active effort to have sexual activity around this fertility window. So to the main topic of infertility. I understand infertility is a very important issue in our society, and you can all bear witness to it. For myself, I'm a living testimony. It took my parents 4 years to give birth to me after they got married. Within that 4 years, it was hell for them, according to them. During that time, we didn't have IVF, IUI, we didn't have a lot of advanced technology, and we didn't have a lot of quality lab facilities around helping us with evaluation. So they tend to move from one herbal doctor to the other, from one hospital to the other, doing a whole series of labs. Fortunately, in their 4th year of marriage, they got pregnant and they got me. After that, they struggled again till date. So I'm the only child of my parents. And I remember when I was young, I used to have this conversation with my mother, and she always wanted to have twins. And unfortunately, she couldn't get them. So maybe by God's grace, God will use me to get the twins for them. So infertility is an important psychological and economic issue, and it has a whole lot of medical implications. Currently, the demand for infertility services has grown substantially, even though the prevalence of infertility has been stable. So what this statement means is that due to advanced technology, the request for infertility services has increased, but the prevalence of infertility is stable. There are a lot of people suffering infertility in the society, in the system, but due to advanced form of technology now, they are now fishing out their issues. So requests or demand for services of infertility are on the rise, whilst the prevalence of infertility is on a flat line or is stable. Based on the global data collected between 1990 and 2021, unfortunately, we don't have statistical data in Ghana pertaining to infertility. So most of the research I did was based on developed countries, European countries, and also in the USA. And I hope in some few years to come, as an organization, whilst we are taking care of people with infertility, we will also come out with our research and our statistics to also support our country. So based on the World Health Organization's research between 1990 and 2021, estimated that approximately 1 in 6 adults has experienced infertility at least once in their life. So it can be a male, it can be a female. The question is, what is infertility? Let me take it from the last definition. That is the most common one that we know. When you Google or when you type infertility, the internet, you just find out this definition. In patients having regular, unprotected sexual intercourse and without any known etiology or cause for either partner, male or female, suggestive of impaired reproductive ability. Evaluation should be initiated at 12 months when the female partner is under age 35 and at 6 months when the female partner is 35 years of age or older. So in the age bracket of less than 35 years for females, if she doesn't have any known cause of infertility and she has been having regular unprotected sex for 12 months without getting pregnant, that woman or that female is known to be suffering from infertility. If the lady is above 35 years of age and has been having continuous unprotected sex for 6 months without yielding a baby, that particular lady is suffering from infertility. Please, do you understand? Now we climb out. The American Society of Reproductive Medicine also define infertility as a person or a female or a male who needs medical intervention. So if you're a male or female and before you can get pregnant, you need medical intervention, including but not limited to the use of donor gametes or donor embryos in order to achieve a successful pregnancy. That person is known to be infertile. So if you need medical intervention to help you get a baby, it means that you are suffering from infertility. The last one is the inability to achieve a successful pregnancy based on the patient's medical, sexual, and reproductive history, age, physical findings, diagnostic testing, or any combination of these factors. So if we assess you and realize that you have medically related issue that is preventing you from getting pregnant, we can classify you under the category of being infertile. Or if we assess you and realize that based on some deformities of your sexual or reproductive system, you are not able to get pregnant, we can classify you under this bracket as suffering from infertility. So, what are the types of infertility? Yes, we have types of infertility. We have primary infertility. We have secondary infertility. These are the main two types. The other one is a garnished term that we usually use, that is subfertility. And it means that there is decrease in the ability to conceive. It doesn't mean you can't conceive, but you need a lot of time before you can conceive. So we garnish it to be subfertility. Primary infertility means that these couple have not achieved conception or pregnancy. Under this, we have two types. So the type 1 means that they've never been pregnant. Their whole years of marriage, they've never been pregnant. That is type 1 primary infertility. The type 2 means that they've never achieved live birth. What it means is that they've been having consecutive spontaneous miscarriages. They get pregnant at 12 weeks, 18 weeks, 24 weeks, they miscarry. So they've not been able to attain a live birth. They fall under the category of primary infertility. Secondary infertility means that they've been able to achieve a live birth before, they've given birth before, but for a period of 1 year, they've not been able to give birth again. And at that, we have ever been pregnant with or without live birth. So they've been pregnant with a live birth or without a live birth. Maybe at the gestation of maybe 36 weeks or 38 weeks, the baby died in the uterus, what we call a stillbirth. Or maybe they miscarried in early stages of pregnancy. But now they cannot get pregnant or achieve live birth again. So they've had a stillbirth, they delivered, the baby had died, or early neonatal death. But currently, for a period of 1 year, they've not been able to achieve a live birth. These people fall under secondary infertility. And as I talked about earlier, a Ghanaian term of subfertility is also used for people who need a lot of time to be able to get pregnant. And 50% of normal couples achieve conception in 1 month. So research proves that if you get married without any issue, any medical related issue, everything is fine, about 50% will get pregnant in 1 month. 72% will get pregnant in 6 months. 80% will get pregnant in 1 year. And 90% will get pregnant in 2 years. So you realize that it's a matter of time. There is no rush when it comes to conception. Each and every individual has their own pace at which God has ordained for them. Some people, they hit it once, they get pregnant. Some people will hit it multiple times. It will take a very long time before they can get pregnant. When you come to this world as a female, you have something we call ovarian reserve. You have a lot of eggs when you are young, but as you grow, your ovarian reserve depletes. So you realize that you get to a stage where you no longer menstruate, and that stage is called menopause. The menopause means that your ovarian reserve has depleted, so you don't ovulate, you don't menstruate again. So age and infertility are related. As you age, so do your ovaries. Most of the times, when people come to our facility, 40-year-olds, 45-year-olds, recently I had a 49-year-old woman. She came in with lower abdominal pain, feeling some discomfort in the body. I don't know what triggered me. I just requested for UPT, that is urine pregnancy test. To my surprise, 49 years. She's pregnant with the 11th child. Yes. Or in the Volta Region, you see a lot. She has 10 children, and the current one is the 11th one. She wasn't expecting it, so she was a little disturbed. I asked myself, someone has been fighting for this. Just one. Just one, oh, not two, just one. And this one has had 10. And she's having a pension baby. And at her age, she is prone to pregnancy complications. Because as I said earlier, as you age, your ovaries also age. You have issues like preeclampsia. Preeclampsia, we will get time to talk about this. As time goes on, Xoese Ghana will be educating people about these conditions because they are the most common issues that we have in the hospital. That leads to maternal mortality and morbidity. You realize that pregnant women will come in, their BPs will be very high. In the twinkle of an eye, but you will check the fetal heart rate, there is no fetal heart rate. The baby is gone. So preeclampsia and eclampsia is a very serious condition that we will be educating the public on as time goes on. And it happens because, yes, in early ages and in late or in the elderly, these people are prone to having these hypertensive conditions. And in the 49-year-old, as I talked about, she will definitely encounter such issues. And sometimes we are stubborn to the extent that when you give them antihypertensive medications, they will just take for a week, and that's it. They will not take again. Once again, I want to tell you that hypertension is a silent killer. Take this from me. Hypertension is a silent killer. It's a silent killer because when your BPs are high, you will not, it's not visible for you to see that, oh, your BPs are high. By the time you realize that you'll be having severe headache or you'll be having stroke, at that point, the damage has already been caused. And hypertension is a progressive disease. Without management, it worsens. That is why in pregnancy it's very serious and it's very important to be on medication for hypertension. So when you come to our facility or you go to any hospital, pregnant woman, and realize that your BPs are more than 160, 110, regardless of the gestation of the baby, we will deliver you. We will deliver you and send the baby to the neonatal intensive care unit. It's the best course of action because if we don't, you lose the baby and or you may die. Because from preeclampsia, you enter into something we call eclampsia, where you'll be having fits or seizures. And when you start fitting, it's a very serious condition. If care is not taken, you may go along with the baby. So as we are all adults here, some of us will be getting pregnant and things. Take note, if you go to the hospital and you are counseled that your BPs are high, take it very seriously. The World Health Organization Task Force on Diagnosis and Treatment of Infertility did a study of about 8,500 infertile couples. And they realized that the standard diagnostic criteria to determine the medical conditions contributing to infertility includes that 5% of couples, let's take it from the first one. So in developed countries, as I said earlier, we don't have statistical data in Ghana. So in developed countries, 37% of infertile couples, they had the female factor of infertility. Male factor of infertility attributed to 8%. And both male and female factors attributed to 35%. 5% of couples had unexplained infertility, and 15% became pregnant during this study. So 5%, they realized that structurally, the ovaries are fine, the uterus, the fallopian tubes are patent, everything is okay. Hormonally, they are fine. The male side, semen analysis, everything is correct, but they were not getting pregnant. So it's sometimes called infertility of unknown etiology. Like you do whatever you can, but you cannot find the main cause of the infertility. Those people will benefit more from IVF, IUI, which my boss will talk about later. And this study illustrates that infertility should not only be assumed as a result of disorders of the female partner. There are male factors of infertility also. So don't always blame your wife. Take a good look at yourself first. We had a client, we asked the husband to come for semen analysis, up to date. He has not stepped foot in the hospital. And this woman, the lab findings, everything is fine. Like she is very healthy. She's a 38-year-old. 38 years. And she's having this issue. So she's eager to find solutions and ending solutions to these issues. But the husband is not supportive enough. For all you know, maybe he knows he has a problem that he doesn't want us to find out. And this husband will be blaming the wife as the cause of their infertility issue. So there's a lot going on in our marriages that needs close attention. So when we talk about reproduction, reproduction requires the interaction and integrity of the female and the male reproductive tract. What do we need for you to be fertile? What do you need for you to give birth? There's supposed to be a hormonal balance. For a female, your period or your menstrual cycle revolves around hormones, the follicular stimulating hormone and luteinizing hormone. We wouldn't go deep into that, but you have to know that it revolves around these hormones, and you have to have a balance between these hormones before you can get an adequate menstrual cycle and adequate ovulation to get pregnant. Also, the man has to produce adequate spermatozoa. Some guys have low sperm count. Some will ejaculate, and you see that the sperms are enough. The quantity, volume wise, is enough. But if you put it under a microscope, you realize that some don't have good motility, some are deformed, some are dead. And these are issues that are existing in our marriages. So you need adequate spermatozoa, and you need them to be active and well. Like they should be moving freely. They shouldn't be deformed. They should have a head, a tail. They should have everything intact before you can achieve a successful pregnancy. And the normal transport of the gametes to the ampullary portion of the fallopian tube, where the fertilization occurs. So in females, we've all seen, if not all, most of us, we have seen the structure of the female reproductive system before. You see the uterus, you see two fallopian tubes, and at the end of the fallopian tubes, you have your left and right ovaries. You need your tubes to be patent for the eggs to be transported to a part of the fallopian tube. When the egg gets to the particular part of the fallopian tube, that's the ampullary portion, the sperm will swim towards that egg, and fertilization will occur at that particular area. After fertilization has occurred, it now moves into the uterus to implant, and that is where the baby will go. So you need factors available to transport the egg from the ovaries to the fallopian tube, and from the fallopian tube to the uterus. If there is any blockage at any particular point, this cannot be achieved. So you realize people have something we call ectopic pregnancy. It means that the fertilization occurred in places that they weren't supposed to occur. So by that, if the child is to develop at that particular portion, the woman may bleed out and die, because the fallopian tube is a very thin tube, and you can't have a very big baby in a very thin tube. But God made the uterus elastic, muscular, so it expands and enlarges as pregnancy progresses. That is why we tell you that if you have an ectopic pregnancy and it's leaking or it has ruptured, you need emergency care. You need to be operated on. And unfortunately, you have to cut off one tube, the tube that has been affected. You have to cut it off, meaning you survive on only one fallopian tube. And this will decrease your chance of fertility. Because even with two tubes, you realize that you have 90% chance of getting pregnant in 2 years. Some people will get pregnant in 2 years, then it has 90% chance of getting pregnant in 2 years. How much more having only one fallopian tube? So we have to be careful when you miss your period, you do urine pregnancy test, you are pregnant, quickly you go to the hospital, you do the scan, you find out what is going on, the location. Early intervention can help. Sometimes surgeries can be avoided. We have medical management. Well, sometimes they fail, but they also work sometimes. So if we detect it early, we will be able to help you. And subsequent transport of the formed or embryo into the endometrial cavity for implantation. And problems related to this is that sometimes you also have fibroids, and the fibroids will be so huge that it will not help the fertilized gamete to implant into the uterus, there will be no space for the fertilized ovum to implant. So you realize that you easily miscarry because there was no place for implantation. So issues with fibroids are also very important. One population-based study came out that male factor of infertility contributes to about 26%. And this revolves around hypogonadism. When I talk about hypogonadism, it means that there are some men who have, excuse me to say, micro penis. So the penis is very tiny, and you are laughing. They have a micro penis that cannot even penetrate well into the vagina to even excrete or secrete the sperms, for the sperms to even swim. They have underdeveloped testicles that cannot produce adequate sperms. They have post-testicular defects, like they have a trauma in their youthful ages. You know, when we are kids, we used to play some kind of play there. It was very bad. I don't know if most of you remember a particular play called Sukunde. If you remember, the way you are laughing, you play. You'll be there, someone will use the tongue through your back. Sukunde. By the time you realize, the person has hit your testicles. And at a very tender age, young age, you'll be playing, someone will just stamp on your groin area. And these issues tend to affect us when we grow up. Seminiferous tubal dysfunction. There's a particular system in the testicles called the seminiferous tubal that helps the production of sperms. So if you have this dysfunction in this particular area, your sperm count will definitely be low. You will not produce adequate sperms. We have ovulatory dysfunction. This is where we have PCOS, which we talked about last year. We have tuber damage. So there may be blockages of your fallopian tubes. It may be accidental blockages. Maybe you went in for an operation and accidentally, it doesn't usually occur, but it may occur that whilst the doctor was tying some organs, accidentally the doctor tied your tubes. It can happen. And also maybe you went for a particular procedure called BTL. For that one, you have agreed that you want your tubes to be ligated, so it's bilateral tuber ligation. So you ligate both tubes. That means that you don't want to get pregnant again. Or you had an ectopic pregnancy where the tubes may have to be removed. And endometriosis is an issue that we'll also talk about in the future because it's a very important issue affecting those females that they don't know. All right, go to the next slide because of time. So who needs evaluation? As I said earlier, above the ages of 35, you are given an ultimatum of 6 months. Below the ages of 35, you are given an ultimatum of 12 months. So if you are below 35, we assess you, you realize that you've been having continuous unprotected sex for 12 months. You are not getting pregnant, you need evaluation. You need infertility evaluation. If you're above the age of 35, you realize that you are having continuous unprotected sex for 6 good months without getting pregnant, you need evaluation. What does this evaluation entail? So when you come to the hospital, we take your history, we talk about your past medical conditions, your surgical conditions, the operations that you've had in the past. It will help us to ascertain the cause of your infertility. We also talk about the medications you are on currently. Some medications like chemo medications may affect your fertility. So we'll fish out all this information to help us evaluate you properly. And we'll also talk about your lifestyle, cigarette smoking, alcohol, marijuana, and where you work. It's found out that people who work in mining areas where they are exposed to a lot of chemicals, they tend to be subfertile. So we will fish out where you work, industries which use some chemical agents affect fertility. And also we will talk about the frequency of sexual intercourse and the use of lubricants. Some of these lubricants, if you apply them inside your vagina and there is sperms introduced into the vagina, these lubricants tend to reduce the motility and the viability of the sperms. So you will have sex all right, you will ejaculate fine, but the sperms will die or they cannot swim to the eggs. So these are some of the historical questions that we will ask to fish out the issues of infertility. So for males, we'll do the semen analysis for you. For the females, we'll do the test for ovulation, we'll do the tuber patency test, we'll do the test for uterine abnormalities, including the ultrasound scans, the hormonal profiles. We will fish out if there is any infection going on that we have to treat. Then we will arrive at a particular means of healthy meal. How can you enhance your fertility? You have to eat a healthy diet. We have to involve our nutritionists and our dietitians in our fertility lifestyle. We are underusing our nutritionists and our dietitians. Some of you don't even know that we have dietitians in the system. When you want to lose weight, most of the times you benefit from talking to a dietitian or a nutritionist to regulate your diet, what you have to eat, what you don't have to. Certain medical conditions, you need a dietitian, you need a nutritionist to help you to control that particular medical condition. The same thing with fertility, you need nutritionists and dietitians to educate you on foods that you have to eat to make you more fertile. Also, you have to get a regular exercise, you maintain a healthy weight. You remember when we talked about PCOS last year, we said even a decrease in 10% of body weight goes a long way to boost your fertility in patients suffering from PCOS, especially having obesity as a comorbid condition. So maintaining a healthy weight is very important. And you have to also stop smoking, alcohol, illegal drugs, over-the-counter medications, and a whole lot. And you have to also keep your environment safe. How do you manage infertility? So as we've said earlier, we've talked about a whole lot of causes of infertility. It can be due to the ovaries, it can be due to the fallopian tube, it can be due to the uterus. It can also be due to the man. When we find out that you are having issues with your sperm, we help accordingly. When we find out that you are having ovarian issues, we treat you accordingly. If it's tuber issues, we will help you. If it's uterine issues pertaining to fibroids, endometriosis, whatsoever, we will help you accordingly. So we analyze you, we evaluate you per the cause of your infertility. We provide appropriate interventions. So you have to know that you have to be sympathetic with subfertile patients. Do not stigmatize, but give them the necessary support. Thank you.
Thank you, Dr. Samuel. I believe you've learned a lot today. So one thing that today I'm taking home is fertility window. Very necessary. So he stated that with fertility window, you should have conscious sex and then don't miss your fertility window.
Good evening once again, and welcome to that's my church. But this morning I didn't come to church, so I have to be quick and get out of here before Father sees me. As a Catholic, normally we're not supposed to talk about IVF, but things are changing now. Dr. Gyedu has basically taken us through a thesis of fertility and infertility. He's gone into very much detail, so I don't need to belabor the point. We'll probably just go into the management and some of the new breakthroughs that are available. Okay. So this is a quotation normally I use for my fertility patients. If you keep these two in your head, eventually you'll get what you are looking for. The next one. So this one has. So which couples actually need IVF? From what Dr. Gyedu has explained, most of the fertility issues you don't need IVF. It can be handled without, maybe sometimes without any medication at all. Sometimes you get patients coming to you and you say, Doc, I've been married for 5 years, I can't get pregnant. Then you ask her, so where's your husband? So my husband is in the US. They ask, how are you going to get pregnant if your husband is in the US? But she's calculating the 5 years from the day of the marriage. So they are not even having sex at all, but she expects to get pregnant. So most of the challenges of infertility can be solved without these expensive procedures. Most couples, they'll come to your consult room. They are not even talking. So if you are not talking in the consult room, obviously you're not having sex at home. But they expect you, the doctor, to solve their problem. For these patients, just having sex at the right time or showing them the fertile window that was explained previously is enough for them to get pregnant. Some of them, they are not ovulating, polycystic ovary syndrome. All they need is medication to ovulate. So most of the fertility issues can be resolved without going into the IVF and all that. And Dr. Gyedu also mentioned something, patience. If you take a woman, a couple, even a couple who have kids already, and you put them in a hotel room, you feed them, you track their ovulation, you let them have sex. At the end of the month, only 25% will be pregnant. Only 25%. Human beings are not as fertile as we assume. So you can track the ovulation, you can let them have sex at the right time, the sperm is fine, the tubes are fine, the uterus is fine. Only 25% will get pregnant. But at the end of the year, 80% of them will be pregnant. So let's not be too much in a rush that, oh, this month I did my ovulation tracking, I saw ovulation, I had sex, why am I not pregnant? It brings a lot of anxiety, and anxiety is one of the factors that reduce your chances of achieving conception. So some of the factors that causes male infertility is already been discussed. We'll go to the basic evaluation of a couple for infertility. In some countries, in actual sense, if you don't go with your husband for the first checkup, they are not going to evaluate you. Because when we were medical students, they used to say 30% man, 30% woman, 30% both of them, 10% as the causes of infertility. But from experience and from the patients we see, it's actually about 40-45% male. A lot of the patients will come, oh, doc, evaluate me. My husband is fine. You do all the tests, she's fine. Where's the husband? Oh, they'll give you also, even the women themselves give reasons why their husband shouldn't be evaluated. You finish with me, then I'll go and see what I can do. Then you get the husband to come, and the problem is from the husband. I remember some time ago, I had a couple. They had just been married for 2 months. They came, they want fertility evaluation. I said, this is going to have some sex. You're not even 30 years. Come back in a year's time. No, let's do it now. And when we ran the test, the husband had 0 sperm. 0. And me, the doctor, I was even sweating more than them. Because I didn't know how to bring the news. So I just wrote a new one that, oh, can you have your test repeated? Then he said, doc, why? What's here now? Then I had to break the news down. It's not an easy thing. So erectile dysfunction, sometimes the technique of sex is the problem. There are people who have what we call hypospadias or epispadias, where the opening of the penis is actually not where it's supposed to be. So all the sex he's having, the sperm is virtually going onto the bed. Meanwhile, he thinks he's doing it. Then for patients with maybe diabetes or even the normal stress of life. Now, a lot of men, if you are selling alcoholic drink and you add aphrodisiac, that is the best. They go like, a lot of the young guys are not able to even sustain an erection. During the course of sex, the penis is not able to hold up. Then there's a real, what we call isospermia, where there's no sperm at all. which either could be due to a blockage in the duct that brings the sperm into the penis, or some patients are born with a condition where they don't have any sperm at all. They don't develop sperm. There's no sperm even in the testes. And those men, normally when you see them, very handsome, no hair on the face and all that. So sometimes I tell my friends that, look, the ladies, that don't look for too handsome a man. Then there's a low sperm count. I'll show you a graph of how sperm counts have been over the period. Then I mentioned the last two, no sex at all, but they'll tell you they've been married for 5 years, 10 years, no issue. Can we go to the next one? So this has been discussed already, causes of male infertility. Yes, and this is a graph of, if you look at it, this is a graph giving a perception of sperm quantities over the years. And I believe this is 1970. If you look at it, the sperm levels has just been going down over the years. From this point, it's just been going down so we're even getting to the red zone. And with time, there will probably not be any sperm at all. So these are the normal things that you expect from. The problem is that the man's evaluation is actually the simplest. You just have to produce sperm for us to look at. Because the evaluation of the woman, especially looking at the tubes and all that, these are very painful procedures, but yet still the men wouldn't come. So if you get a sperm count, these are the parameters that you have to look. It's not just about you producing sperm. The volume should be enough. The concentration, you should see about 50 million sperm in the ejaculate. People will say you just need one sperm to impregnate a woman. It's not true. You need a lot of sperm to surround the egg for them to break down the wall for one sperm to penetrate. So it's not about just one sperm getting you pregnant. Then some people will have, the count will be all right, but a sperm will be having maybe, a sperm is supposed to have one head, one body, one tail. Some people, the sperm will be having 2 heads, 3 heads, no tail, no body, and you'll be seeing them there. Then there's something called motility. Sperm is supposed to move in a straight line rapidly. But sometimes when you get a semen and you look under the microscope, some are going in reverse, some are going this way. Most of these are not going to impregnate a woman. So this is a basic evaluation of a man. It doesn't take more than a day. You come 5 minutes, you produce a sperm, you finished. That's it. Then we can concentrate on your wife. Next one. So some of the problems I've mentioned how to tackle them. Can we go to the next one? Dr. Gyedu has discussed this one, so audience, let's go to the next one. Yes, so this is the graph I was talking about, the likelihood of getting pregnant. Age is the most important factor in fertility, especially for the woman. Age answers everything. If you look at the graph, your chances of getting pregnant most often is 20 to 24 years. From that point onwards, you are just going down. So when you get to 40, 44, it's very low. Even this 36 quoted years higher than what normally you would have. And between 45 and 49 is virtually zero. So that's where assisted conception methods come in. This is also showing the same pattern, fertility going from 20 to 24 to virtually 0% at 50, and even 45 to 49, less than 5%. So age is key in fertility. That's why sometimes you get a couple, they'll come, we just got married, we want to have fun for 2 years. We don't want any disturbance from babies. It's not as easy as that. You don't pick a baby when you want. You have to start working on it immediately. Because with age for a woman, your egg levels are going down, your fertility is going down. Now most women are going to university, I want to go and do my master's, I want to do this, I want to do that. By the time she's done, she's about 36, 38. Now she wants to have a baby in 1 month. Next one. So these are some of the causes of tubal blockage in a female. So the solution, IVF. IVF doesn't answer every question. But the first IVF was done amongst non-mammals, 1959. So it was done for a cow, and they had a baby cow. It took about 19 years for them to achieve success in a human being. That was in 1978. The first IVF baby is called Louise Brown, and she's had babies subsequently without IVF. Then in 1995, the first IVF baby was born in Ghana, Provita Hospital, Tema. The rest, they say, is history. The next one, please. So there's IVF, then there are other advanced methods of achieving conception. There's what we call conventional IVF, that's the basic one everybody seems to know. Then there are other methods to help achieve conception. There's what we call ICSI, then testicular sperm aspiration. Some men, he will not be producing sperm for it to come out, but he still got the sperm in the testis. So we can pick the sperm from the testis. I'll show you how it's done. Then we can use it to fertilize the egg and put it in the mother. Then there's fertility preservation. Now people want to go to school or people have started new jobs. I don't want to have a baby now. You can store your eggs for up to even 10 years, 15 years, and use them when you are ready. So that egg will be the age at which you are storing it, not your biological age. So this is a low-tech intrauterine insemination, a low-tech method for achieving pregnancy. Basically, what is done is to try to get as much sperm as possible into the woman's womb. So either the woman goes through some medications to develop a lot of eggs, or you can even do it with natural, what we call the natural cycle. So you monitor the patient's cycle, and during the fertile period, you collect the sperm from the husband, process it, take only the live ones, and put it directly in the womb. And it gives some good successes. The next one, please. So who needs insemination? Male factor, when the sperm is very low, not very low, minimum at least 1 million, you can use insemination. Then conditions that prevent the sperm from being deposited at the right place. I've mentioned that already. There's something we call discordant HIV couples. There are couples who've lived together for a long time. Maybe the woman is positive, but the man is not. You could collect the man's sperm, process it, and put it in the woman directly to prevent him getting infected. And when donor sperm is required, when the sperm count is so poor, we're not able to get it from the testis. Sometimes, rarely, you might have to opt for sperm donation. In which case, I don't think anybody will allow somebody to come and sleep with a wife. So we collect the sperm and put it directly there. Then ejaculation problems. Sometimes the husband is going away for a while. The woman wants to get pregnant. We can collect the sperm, store it, then we can use it to inseminate the woman while the husband is away. Then single women. That's controversial, but a woman has a right to have a child, whether she's married or not. So there are some patients too that the fluid in the woman's vagina is hostile to sperm. So even though the sperm might be normal, the moment it's deposited in the vagina, they are all killed. So for that, insemination can be used. Then unexplained infertility, he mentioned it earlier on. They've checked everything, there's no problem, but it's not happening. IUI is an option. And the success rate is about 15%, which is quite low, but it doesn't cost much. So you can repeat it several times. Elsewhere, people actually go to the lab, get their sperm processed, come and do it at home, because you can inseminate yourself at home. Next slide, please. So this is a quick diagram of how the insemination is done. The sperm is collected That's the sperm swimming in the fluid. So the embryologist will process it. Then the doctor will just, with the aid of a syringe, put the sperm directly into the womb. And from this point, it's quite close to where the eggs are. So it's easier for the sperm to be able to catch a number of eggs. Sometimes we give the woman medication so that instead of the one egg that a woman will get during a normal cycle, you can get about 10 to 15. So with a lot of sperm, with a lot of eggs, one could catch one. So these are the indications for IVF, which I've already gone through. So IVF is slightly different from insemination. Basically, what we are doing is trying to fertilize the egg outside and put it back in your womb. To do that, we need to put the woman through some injections to retrieve a number of eggs, about 10, 15 eggs. So she takes these injections for about 14 days. Then you will see that the eggs are developing on the scan. When we think the eggs have reached the point that they are ready to be picked up, we take you to theater. It's a minor procedure. We've had people we've taken their eggs out and even gone back to work or gone back to write exams and all that. So it's a minor procedure. There's no cuts or anything. We just use a needle that is attached to an ultrasound scan, and we pick the eggs from the womb. Within a short time, 1 hour, 2 hours after, you're up and about. You might have a bit of pain for a day or something. Just normal paracetamol should be enough. So once we pick the eggs, then we give it to the embryologist. Then the husband will have to come and produce the sperm. So for the conventional or normal IVF, the sperm and the eggs are just mixed in a tube, and the next day we check and see how many have fertilized. But we'll come to when the sperm levels are very low, you cannot use this method. So you might have to do something we call ICSI. So once we fertilize them, we keep them in the lab for 5 days. You see the baby or babies growing and expanding. So normally on the 5th day, we take the woman back to theater. Also a very minor procedure, no anesthesia. Then we'll put 2 or 3 embryos or babies back into the mother's womb. Then we'll wait 14 days to see whether the babies have been planted or not. Okay, the next slide. So depending on the age, as I mentioned, your biggest success is age. The younger you are, the higher the chances of getting pregnant with IVF. But putting it all together, success rates are about 40 to 70%. We still haven't managed to achieve 100% yet. But with the new technologies coming up, eventually we might get there. So this is what we call ICSI. This is for very poor sperm counts. When the count is very low, when you mix the eggs and the sperm, most often there will be no fertilization. So we have to do a procedure we call ICSI, where we inject one sperm into one egg. And that increases the chances of fertilization. It comes with a bit of cost, but in Accra Fertility, we don't even charge for the ICSI. It's free. So that's for very poor sperm quality. When there's exospermia, when you have to pick the sperm from the testes, you require ICSI. The next slide. So this is how it's done. This round one is the egg. Then this tube will have the sperm in it. So you inject the tube into the egg and deposit the sperm. This is by force fertilization, whether you like it or not. You have to catch the eggs. So yes, that's basically the difference between conventional or classic IVF. So here you see that we put an egg there and we added the sperm to it. They'll swim and swim and swim, then one penetrates. Here, the ICSI, we actually put the sperm itself straight into the egg. So the chances that it will fertilize is very high. So that's the same thing here. That's the sperm in the tube there. This is the egg. And we're injecting it directly into the egg. Then I mentioned sometimes you have to pick the sperm from the testes. So when the sperm is produced in the testes, it goes through a tube. what we call the vas difference to come out as the ejaculate. Sometimes there's a blockage of that's what we call the vas. Especially, yes, that's so the sperm comes from here, comes here, then it comes out. So for some reason, especially in children, when they go for hernia surgeries and all that, if you're not careful, then the vas can be tied. If the doctor is, because the tissues are very small. Injuries, infections, gonorrhea, chlamydia, all these can block the vas. So the sperm will be in the testis, but it's unable to come out. So we have to do what we call testicular sperm extraction or testicular sperm aspiration. The next slide, please. So these are some of the ways of picking the sperm from the testis. So there's a needle attached to the syringe. Then it looks very uncomfortable when it's being done because you hold the sperm, the testis, and you put in a needle, and you know how precious the balls are to a man. Yes. So you can imagine how the guy is holding the testis and injecting it. But it's a minor thing. After some painkillers, you should be okay by the next morning. Then there's what we call pre-implantation genetic testing. The normal IVF, after you've gotten the embryos, we transfer it, we look at the shape, some few features, and we say this is a good embryo, then we transfer it to the woman. But sometimes, looking at it alone doesn't tell you that the embryo is very good. So we have ways of assessing the embryo for its genetic makeup to be sure that the embryo we're going to put in a woman actually has the 46 chromosomes that everybody is supposed to have. Not only that, the second one is also controversial. Some people will come that, look, Doc, I have 5 girls, I want a boy. So make sure you get a boy. There's a way of selecting to make sure that the embryo is a boy. But it's been banned in a lot of countries to do that. Then there are what we call patients who have certain genetic or conditions that they could pass on to their children, like sickle cell anemia. So if I'm AS, my wife is AS, there's a possibility that we could have a kid who is SS. So we can use this PGT testing to pick out the kids that are not SS and transfer it to the woman. So it's a very good technology that is available in Ghana. So that's what I was talking about. Next slide. Then the last aspect I want to talk about is the fertility preservation, where maybe your husband is not around, he's traveling. We've had people even sending their sperms from, maybe he's gotten to the US with false papers, but he can't come back. The wife is waiting here. So there's a way of getting the sperm there and bringing it to Ghana. Then we can use it for either IVF, insemination, or something for the wife to also get pregnant. Or ladies might come along that I don't want to have a baby now, but I think I'm growing. There's no man in my life. I want to store my eggs so that in future, if I get somebody, we can store that. We can store the eggs, we can store the sperm, we can store embryos. After you finish the IVF process, you can decide, oh, I want to wait, so I don't want to have a kid now. We can store the embryos for up to 5 years, 10 years. We have embryos that have been there for so long. The patients have gotten pregnant, have about 2-3 kids, and they don't want to come back for it. They don't want to. Next one, please. So, to round it up, I want to talk about a few things that, because IVF is like a laboratory, it doesn't sound normal. The typical thing is that babies are made in the bedroom, and all of a sudden we are making babies in the lab. So people have a lot of misconceptions about it. Some will say that babies born out of IVF are abnormal. It's not true. The first baby, Louise Brown, is very normal. She's had her own kids and all that. She's not getting any strange diseases. And millions of babies have been born from IVF. There's so much data of babies being born from IVF who have grown into adulthood without any problem. They have no cognitive problems. They're as intelligent as any other child. They grow as any other child. So there's nothing abnormal about IVF babies. Then the second misconception is that some people will come, oh, this is my pregnancy, I want to be twins, so I don't want to go 1-1 again. So I want to do IVF. IVF doesn't always give you twins. The reason why people tend to get twins or triplets out of IVF is that we normally put 2 or 3 babies there after the process. So your chances of having twins is very high. It doesn't mean every IVF will result in a twin. Then the third one is IVF is the last resort. It's not the last resort. People have had failed IVFs and even gotten pregnant naturally without any medication at all. I remember there was a patient we had some time ago. She was coming to do IVF. She had paid her money, everything. Then she came that, but she's not having her menses. She's been married for 15 years. She's not having her menses. So I was just going to write medication for her menses to come. I said, let's do a pregnancy test first. And she was pregnant. You know, she was pregnant. And it happens all the time. People have one IVF, their subsequent pregnancies, no IVF. So it's not like it's the last resort. Once you do IVF, all your children are going to be, no. Then IVF can be done at any age. That is not true that you can do IVF at any age. The younger you are, the better. When you go beyond a certain age, fine, IVF can be done, but you might have to use somebody's eggs. That is a reality. Most often after 43, 45, when we check your ovarian reserve, it might not be up enough. So you might have to opt for. So you can't just wait and say, oh, I'll have the money, but I'll do it 5 years' time. There's a time limit. And even apart from that, you have to be medically fit to be pregnant. So you can't come at 60 years and say, oh, I want to do IVF. And because it can be done, the doctor also does it. Because at 60, the complications of pregnancy, even from 55 going, the complications of pregnancy is so much. Diabetes, hypertension, preeclampsia, eclampsia, fitting and all that. Heart failure. So as much as IVF can get even a menopausal grandmother pregnant, it doesn't mean that anybody who comes at whatever age, IVF should be done for the patients. Then people will also say that once you do IVF, you have to be in hospital for the 9 months. It's not true. When IVF began first, people were admitted after the procedure for months because of the cost involved and how delicate it is. Everybody was worried about what could make it go wrong. Nobody is admitted now. Admission is optional. Once we transfer the embryos, people get up, go and sit in their cars and go home. Some will say, oh, because of the injections I'm supposed to have, there's nobody to give me that injection. Go in and come in will be difficult. I want to be in hospital. Once you get pregnant, you go home. And your antenatal cost is just like any other pregnancy. There's nothing special about it in any other way. And there's nothing like bed rest for the 9 months. You can go to work, do your normal activities. Of course, you have to take some precautions, but there's nothing like being in bed for 9 months for IVF. Those ones were in the 90s when it started first. The complications are no more in IVF than in normal. You don't necessarily need to have a cesarean section if you have an IVF. You can have a normal delivery without any problem. Then I think I've answered this one. Then the key one, IVF is expensive. Because of the amount of money the person is paying, the person assumes that once she's paid that money, she has to take her baby home. Unfortunately, technology has not reached that point. It's a very effective tool to get pregnant, but it is not 100%. It is not 100%. Elsewhere, the government will pay for about 2 or 3 IVFs for you before you have to pay out of pocket. Unfortunately, in Ghana, even malaria is a problem. Then the last one, IVF increases your risk of cancer. There's been some debate about it because of the medications you use to get so many eggs. that there's a possibility of getting ovarian cancer. It's not been proven that IVF causes ovarian cancer or any other cancer. So, preparing for IVF. IVF is not an emergency. Don't go to the hospital just because your friend just had a baby. Today, I also want to start. My period has come out to start. Please plan for it. It takes a lot of emotional, psychological workup to undergo the procedure. Plan for it. Optimize your health. If you are diabetic, let's get it under control. If you are hypertensive, let's get it under control. Don't just try that I must have a baby this year. Whether my BP is this, whether I'm going to die or not, I must have a baby. Take your time. Let's make sure you're in the best of health before we go through the process. And there's so much information on IVF in the system. Most often now, some of our patients, they don't want to know anything. Doc, my money is ready. Collect it and give me the baby. You need to read about it. You need to know at every point what is happening. So you also understand you're part of the whole process. Then, of course, you have to prepare financially because the medications that are used for IVF is quite expensive. The procedures that I'm talking about are a bit expensive. I mean, keeping a human being from growing for about 5 years and all of a sudden you make it start growing is very serious technology. Or to freeze a sperm. The sperm, it's like putting something in the deep freezer. Then, or you put your chicken in the deep freezer, then you bring it out, the chicken starts moving again. It's very serious technology to achieve that. Because of that, the cost is a bit high. Now, because there are so many centers, it's coming down, and some people are working on it to try and reduce some of the taxes on the medications, and it could bring it down a lot more. So avoid alcohol 3 to 4 months before you undergo your IVF procedure. No alcohol at all. Okay? Avoid smoking. Okay? Lots of vegetables. When you look at those from the Mediterranean, Italy, Arabs and all that, when you see their table, their breakfast or lunch table, so colorful. Fruits, vegetables. It shouldn't always be fufu and soup, fufu and light soup, fufu and light soup. One way, So let's try and take more vegetables, lots of fruits, salmon, fish. Fish is very important. Cut down on meat, cut down on chicken, cut down on fatty foods, Indomie and all those stuff, junk food. Cut down on fizzy drinks, stay healthy, exercise. So that's what we call the Mediterranean diet. Friends from the Middle East and all that. Everything is in one meal. Okay, so you have a bit of meat, small meat. Once the eggs, it's fine, but small. So the down ones are the ones that are really important. You cut this one off, drink lots of water, exercise, and most often than not, you will come out successful. So that's my inspiration again, which I always, whenever I'm asking God for anything, these are the 2 things that come to mind. Thank you very much. Those are your babies there.
Xoese Ghana, believe. Xoese Ghana, believe. Xoese Ghana, believe. Have you stretched enough? Okay, then you can sit. Please have a seat. So we'd like to also acknowledge our partners. We appreciate the support helping us to be able to have today's session. We want to thank Accra Fertility Center. Thank you so much, Kenafama Ghana Limited, Tovila Water Solutions, Tema Women's Hospital, Institute for Liberty and Policy Innovation, LAPI, Samuela Ventures, Clarity Specialist Scan, Metropolis Healthcare, IKM Construction, and Cornice Clothing. Thank you so much for making today's conference possible. We would also want to acknowledge some dignitaries who are here. Let's welcome and acknowledge Professor Ejeni Boateng. He's a lecturer at King's College. Please, if you are here, let's see you. Thank you so much for coming. We have Mrs. Irama Lawel. Is it Lawal? I have the name, the handwriting I can't see well, but Mrs. Irama, are you here?
All right, thank you very much for coming. And there's one man here, I have known him, he's done a lot of things. And when I saw him here today, I'm like, this man wears so many hats. Just last week, he was there for us to celebrate the International Missing Children's Day. And today he's here for the Fertility Conference. I have to ask him more questions. Please help me acknowledge Ni Afote Boche II. He's the chief of Otino Nungwa. And he's also the president of the New Life Nungwa Children's Home. He's the founder, actually. Thank you so much for making it here. We would hear some solidarity messages from our partners. And then from there, we'll watch a short video. Then the question and answers time would come on. But before we get there, I have a question. Dr. Homiah, you were saying that it's a little bit expensive. It's expensive. How expensive is IVF? When we come to the question and answer, that's my first question. Please be thinking about it. We are now going to watch a brief video that talks about infertility stigma. And I would want to say that this video we are going to watch, it's one of many of the videos that Xoese Ghana has produced to educate people about infertility. And last week, we were gracious enough to have the award ceremony where Xoese Ghana, the director, she was awarded she won 2 categories. It's an international award by MEC Foundation, awarding her for her stories on infertility and the stigma issues we are talking about. Please, let's clap for her. So what we are coming to see is just a brief of an award-winning video of all that she's been doing. So please, kindly help us watch the video.
So the only thing the girl opened his mouth and tell me that one who the Homiah so not one.
The lady told you that
yes.
you have turned your children, your future children, into water to drink
because of the menstruation and this miscarriage.
She told you that? A woman?
Yes.
A fellow woman told you that?
Yes. So that I'm true. My husband didn't say anything. Then I said, okay. So I came back home to go and prepare to face them. In fact, it's not easy. So during that time, then the marriage ended.
So for Antina, her first victim, the very first person to point accusing fingers at her, to call her names for not being able to have a child, is her fellow woman. It's her fellow woman. So it's been very painful that a fellow woman who should know better, or who should know things that happen to women relating to childbirth, called her name, told her that she had turned her children into water to drink, so that she would just urinate them away, and so there is no way she's ever going to get a child. No, this must stop. Together, we must end infertility stigma. You told me about a prophet whom you had gone to seek spiritual guidance or help to conceive.
Yes.
Who told you he wanted to sleep with you before?
I was there 2 to 3 months before, and he told me that God has revealed to him that if he sleep with me, he want to marry me. I'm nice. I got good heart, so I can even support her doing.
He didn't have a wife?
I don't know.
You don't know?
For me to supporting her
to support him in his service.
Yes. So if he sleep with me, I'll be pregnant. Then I told him that I came here for a purpose. So
you can't do it.
I can't do it. And even if I give myself to him, if you have any good thing to do with me, it won't work.
God will not answer such a prayer.
That is what I told.
So where did you attend this church?
Oh, I attend the church at Mampobi area.
Mampobi here in Accra. The prophet told you he has to sleep with you before you get a child.
It's called Aku.
So Auntie Na was exposed to a lot of spiritual suggestions by her friend. Let's go there, this pastor will help you. Let's go here, this prophet will help you. Until she found herself in the arms of a wrong a prophet. Well, I cannot call him a wrong man, but this prophet, instead of helping her, instead of encouraging her, helping her to be on her feet, despite what she was going through, this prophet wanted to sleep with her. Right here in Accra, this prophet wanted to sleep with her, but she did not give in because she told herself that if I do that with you, it means that God will not even listen to my prayers at all. But why should this be? Why would you want to capitalize on somebody's situation and then want to sleep with her when you know the person is married, when you are also a man of God supposed to help this person? Let us end infertility stigma in all forms.
Remember, I'm working with some woman, and then one of my friend, we are all friends, but at least we'll go out if we hear programs like this for us to go and follow up. And then the woman called her and tell her that we call it Pumene, money bedroom, we could need Johnny bed.
The woman warned the lady, you are associating with this woman. This woman who is barren, who doesn't have a child, who doesn't have anything to think about. So society thinks that if you don't have a child, it means you are empty up there or you don't have anything to think about. Let us stop infertility stigma. Women who are yet to have their own children are still women. They are still human beings and they deserve respect. They deserve care. They deserve respect. Please.
So we'll move straight into our question and answer time because of time. And then I would kindly invite our two doctors who did the presentation to please come up here so that they can easily address our question. Dr. Samuel Gyedu, he's the Gyedu Owusu, he's the board chair for Xoese Ghana, and also Dr. Joseph Homiah, obstetrician gynecologist at the Accra Fertility Center. So it's question time. If you have a question, please raise your hand and then we'll come to you so that you would answer for us.
Good evening.
Good evening.
My name is Lord. When the two doctors were doing the presentation, they made it known to us that most of the fertility issue, the men are the main cause. Most of it is the men who are the main cause of the fertility issue. And I'm experienced with some of these things. Now, sometimes in the lab, you see young couples, they come and then you run a series of tests for them, the hormonal tests and other things, and you realize that most of them, sometimes most people have low testosterone. Then secondly, they're meant to, when you check the semen analysis, you do the semen analysis, you realize that most of them, azoospermia, I mean, there's nothing in there. You cannot even count up to 100. So
Nothing at all.
So bad. Then at the end of the day, those people, the women rather carry the burden because they think the man is young, is strong enough, and other things. Then we have other experiences so that maybe at early stages, the man has had baby before, has had a child before. So they know the man is tried and tested. He's tried and tested, so he's having a baby, so there's no problem. But sometimes to such person, you run series of tests on that person, realize that rather is the victim, is the one causing the new, is the one causing the problem, is the main victim, rather not the woman. That is the problem, but it's rather the man. So I'm asking my question again. You said during ovulation, when one is ovulating, you can have continuous sex. But when we do the semen analysis, we ask that, okay, you should stay. You should abstain for sex for about 5 days so that you can have mature sperm cells. So if one is having continuous sex, how can you guarantee that continuously? Because the sperms take about 72 hours to travel to the egg. So how can you guarantee? I'm asking Dr. Samuel. Then Dr. He said Homiah. It's also saying that if one is having azoospermia with his situation, can something be done about it? And can the person still go on with maybe taking the sperms? Because you cannot see anything. Sometimes at the production of the sperms, less than 30 minutes, everything is dead. You cannot even see even a single. Then those that you see, some of them too are very weak, and then they cannot even move. So those ones, what can you do about it? That you can pick the sperms and then you can fertilize and ovaries with it. That is my question. Thank you so much.
Thank you. So we'll take another round of, please let's keep our questions short, simple, so that it becomes easier. All right, my lady at the back.
My question is to
Please, can you hear her?
Yes.
please talk about fibroid. How does it come about? How can I not prevent it? And also, there was no mention of abortion, but I want to know if it can affect the fertility rate of the woman.
All right. So the last director wants to ask a question. Okay, where she is. Okay, please let's have yours before.
My name is Xoese. Okay, so my question that I want to ask is, at what age in a woman's life that she's supposed to go and check her follicular count to know how many eggs she's having in her lifetime? Because I know we have some women who might be having only one egg that will be able to fertilize. So at what age are we supposed to check all these things? And then two, the second question I want to ask, if your AMH is very low, can we have any medication that will be able to increase it to a certain level whereby it will be adequate for you to get pregnant?
All right, thank you. I think the doctors will answer this set of questions, then we will proceed.
So how can you guarantee after continuous sex that you have adequate sperms surviving? So for semen analysis, the reason why we let them refrain from sex for at least 5 days, you want to get a pool, like a lot of sperms to analyze. And you remember that even in a day, if you go for the first round, the quantity of sperm that you produce compared to the third round, there is a difference. First round will have a lot of pool of sperms, but second, third, or whichever rounds that you go, you realize that the quantity will reduce. When it comes to the fertility window period, I told you the sperm can survive for 5 days. If you ejaculate inside, it doesn't mean that the first time you ejaculated, by the next day, the sperm might have died or something. Do you get it? So having frequent sex is like doubling up. First day, you have, let's say, 20 there. Next day, you added 10. The next day, you added 5. Do you get what I'm trying to say? So with each encounter that you have, at least you have some pool of sperms in the woman awaiting the day of ovulation. The day of gestation. So yes, that's it. And about uterine fibroids and abortion. So for fibroids, one thing about fibroids is that research has shown that it's hereditary. So it's like a first line inheritance. What I mean is that usually if your mother suffered from fibroids, you as a daughter, you have a higher chance of also having fibroids. If your grandmother had fibroids, you also have a chance of having it. And there is no specific cause that, oh, maybe if you eat this food, if you do this, you will get fibroid. It's something that just happens. That is why it's better that at least in your years of life, you try to do a pelvic scan to see what is going on in your uterus. Blindly, you may not know what is going on, but when you reach your fertility age, from age 20 onwards, you can be doing the scan to see. Sometimes the fibroids are too tiny, you don't have to touch. I've done a lot of deliveries, cesarean deliveries. You realize that there are multiple small fibroids on the uterus. They are not causing any harm. You don't touch them. The only time you touch a fibroid is when it affects fertility or when it puts the woman's life in danger. How does it put the woman's life in danger? When the woman starts to bleed. Some fibroids will undergo degenerative changes and they will start bleeding. So you realize after your menses, you'll be having intermenstrual bleeds. In the middle of after you've had your period, 5 days, 7 days later, you'll be having some abnormal bleeding that you can't explain. You do the ultrasound, you realize that you have fibroid, especially the submucosal ones. We have types of fibroids based on location. So some may not cause, some will not touch them. But the others that will affect your fertility, that will affect implantation, they occupy a lot of space. There's no space for the embryo to implant. That is where we have to intervene and remove such a fibroid. Abortions, yes, it was in my mind to speak about it, I forgot. So if you undergo a series of abortions, you realize that we have something we call evacuation of the uterus. So we have medical abortion and we have instrumental or surgical abortion. The medical abortion is when we give you medication. I won't mention the name. We'll give you a medication, then it will expel the fetus. And it's not advisable to use that particular medication at certain gestation. That medication is actually a helper and a killer. At certain stage in pregnancy, when you realize that you are past your determined date of delivery, we can give you a low dose of that particular medication to induce labor. We'll give you that medication, then labor will set in, then relieve you. Nearly labor sets in, you progress normally. But that same particular medication, if you use it in its high dose at early stages of your pregnancy, it can terminate the pregnancy and it can cause abortion. Most of the times, it fails. The clots will come out, but there will be retained products, be it the placenta or other parts of the fetus will stay inside. And you realize you will bleed until that particular portion comes out. That is where we come in with the instrumental aspect. So you come to the hospital, then we evacuate. We put some tubes inside your uterus to scrape off these remnants of conception. And whilst we are scraping them off, definitely some part of your endometrium or the inner lining of your uterus will also be scraped off. It will form scar. Frequent abortion, undergoing these processes repeatedly, will later render your uterus not conducive for implantation. So yes, it can affect your future pregnancies also. So abortion is a very serious matter that we have to take a good look at. And at what age do you need to check your egg count? Naturally, all other things being equal. As Dr. Homiah said, from ages 20 to 24, you are highly fertile. Like you have huge reserves of ovaries. Unless you have a medical condition rendering you not able to have that huge pool. AMH is a test that we usually do to ascertain the ovarian reserves that you have. And it can also help us in our diagnosis of PCOS also. But all other things being equal, if you have a low AMH, it means that your ovarian pool is low. and you usually encounter it in people with advanced age, from 35, 40, 45, 50, hitting menopause. They will definitely have a reduced AMH level. For the rest of it, I think I'll hand over to Dr. Homiah to add up.
Yes, the question about abortion is answered it pretty much. But when some of the products are retained or still in the womb, it's likely to get infected because that's not where it's supposed to be. Once it gets infected, it's going to block your tubes. So abortion is one of the causes of tubal blockage. Most people with abortion, they're going to suffer from infertility. Most often than not, apart from the endometrium, the tubes are also blocked. Then the question about isospermia. Yes, so if we realize that you have isospermia, we have to do what we call testicular biopsy. So we take a small tissue from the testis to be sure that there's still some, because there's obstructive isospermia and non-obstructive. Non-obstructive means that there's nothing at all. Obstructive means there's sperm, but it cannot come out. So if we do the biopsy and we realize that there's sperm in the scrotum or the testis, then we can use what we call ICSI to pick up a few sperm and fertilize them. Then when the count is also very low, normally conventional IVF wouldn't work. So you pick them quickly, and my biologist has so many tricks with the sperm, but he'll get some to inject into the egg, and then the checking the follicular count or AMH. You don't necessarily need to be too anxious about these things and start doing all sorts of tests. It brings anxiety and it doesn't help. If you are having regular cycles, every month you get your menses regular, most likely the egg levels are okay. And most young people, the egg levels are okay. It's just a few patients who have what we call premature ovarian failure, or sometimes because of those who have undergone chemotherapy, then they might have lower egg levels than normal. Low AMH, there's no medication to improve your AMH. A woman is born with all her eggs she will ever have in her life. It just keeps going down with age. Unlike men every 90 days we get new sperm because God is a man. But women, at 7 weeks in your mother's womb, God has given you all the eggs you ever have. From 7 weeks up till menopause, every month you're losing about 50 to 100. But you've got a lot, about 200,000. So much. So with age, then it starts coming down. There's something we call, there's a new procedure trying to improve AMH where they inject plasma into the ovary to try and bring the AMH up, but it's pretty experimental. Maybe with time we'll know whether it's going to help or not.
A round of applause for our doctors. How many of us have questions to ask? If you have a question, please raise your hand. Let me see. Okay, so we will take the last round of questions, 1, 2, 3. But then quickly, let me acknowledge Mrs. Jessica Adute, Principal Regulatory Officer at FDA. Please, if you are here, let's see you. Yes, you are welcome. Thank you for joining us. And then Dr. Emmanuel Osai, he's an embryologist, Accra Fertility Center. Oh, okay. All right. Thank you very much for joining us. And then Mr. Tony Lawal, CEO of Tovila. Are you here? Let's see you. Thank you for being with us too. All right, so we'll take the last set of questions. So the gentleman at the back. Okay, you have the microphone. Right.
Please, Abrefi. Yes, please. Please read the tubal blockage with hydrocephalus, with both. And then one is linking to the other side. I want to know, how does it cause harm to the body without treatment? And the treatment, I want to know, is it surgical or medications? And then with the IVF, the cost of it, please, I want to know too.
Thank you very much for reiterating my question I asked earlier, the cost of IVF.
Thank you for the opportunity. I'm asking this on behalf of the many women, including myself, who are 30 and above. Recently, there was the news item trying to promote the reservation of egg or freezing of eggs. Some people kicked against it. I won't do it. Blah blah blah. There are misconceptions about it. Dr. Homiah, I want you to address this question. Are there risks? What risks are there in freezing your eggs and the benefits? Yes. Thank you.
Thank you for the question. So the last one at the back, the gentleman. Yes.
Yes, thank you very much. My name is Dzodze. Please, I want to know some of the basic causes of low quantity of sperm. That's the volume, the lower volume of sperm. And then, can the same thing denote low count of sperm?
All right.
Thank you.
All right, thank you for the question. So,
Low volume is different from low sperm count. The volume is how much comes out during intercourse, but that is not sperm. What we see after intercourse is not what sperm is. It's seminal fluid. The sperm swim in that fluid. So you can't see sperm with your eyes. You have to look under the microscope. So low volume, you could have a low volume, but a very high count. And have a very high volume, but zero count. So volume and count are completely different. Then you were asking what causes the low sperm count. I showed you the graph from 1970, all over the world, not in Ghana alone, all over the world. Sperm levels are coming down. There's a lot of research, even in Kolevo, trying to find out why men are becoming that way. But the factors that we're looking at is diet. The diet we are taking now, we're eating a lot of junk food. The contomere and garden eggs we used to eat, we've stopped eating all those things. Lots of alcohol, smoking, chemicals. If you go to these galamsey areas, when you let them do a sperm count, it's pretty very poor. Lots of chemicals, aphrodisiacs. Every radio is aphrodisiacs all day. So, yes, and steroids, especially those who go to the gym. When you take these anabolic steroids, it suppresses your testosterone level. And of course, maybe the general stress in the system. Then egg freezing. Egg freezing is not as simple as it sounds. Please, let's not leave here with the impression that, I can go and store my eggs and I will use it 5 years, 10 years time. You have to do it if you need it. In actual sense, the egg freezing previously was for patients who were going for chemotherapy, radiotherapy, because the radiation and the chemicals would deplete all the eggs. So you store the eggs, then after your cancer treatment, you can go back to go and get pregnant. Then it came to the point where people, maybe he's not married, he's not getting anybody, so he wants to. But egg freezing is the same process as IVF. The same process that you go through for IVF. The only difference is that when the eggs are picked, no sperm will be added to it. So the cost is virtually the same as a normal IVF process. So there's no major risk associated with it. It's not going to finish your eggs. But you have to be cautious because when you freeze the eggs and you thaw them, you might not get all of them. You might not even get anything at all. So it's not a guarantee that I'll put my eggs in the bank. So 5 years time, definitely I'll get all of them. You could thaw them and zero. So it's better to rather get pregnant now rather than wait. The cost of IVF, everybody and what it requires in an IVF process. You pick an invoice for this one, it doesn't necessarily mean that it's going to be the same for the other patients. The cost of the procedure itself for most facilities in Accra that I know of is between about 20,000 to 30,000 for the procedure, the cost of the procedure. Then you have to buy the medications that you need. The medications depends on your age. The younger you are, the less medications you need. So if you have a 20-year-old going through IVF, you probably buy medications about 6,000 to 8,000. If you have somebody who is about 38, 40 going for IVF, you probably buy medication like 25,000. So the procedure itself, the cost is not high, but it's the cost of medications. And the cost of medication depends on your AMH. The second thing is that some people, because maybe the AMH is low, might require donor eggs. The donor has to be paid. We have to do a lot of labs on the donor. All this increases the cost. So you could have a 20-year-old, hardly do they come anyway, but you could get an IVF done for about 35,000 because she doesn't need much medication. Then you get to about 38, 40. So basically, you're looking at about 40,000 to about 80,000, depending on the hospital, your age, what you require. I said 40,000, I didn't say. Then, no, but you know what I always say is that if you don't ask, you will never be able to. If you hear I think myself as an example. You know, when I was a medical student, you see somebody's car, hey, this guy will never be able to afford it. Then you start working, then you buy a small Golf. Then you see somebody driving a Mercedes, hey, you doctor there, how are you going to get one? I mean, once you ask and you start working towards it, you realize that eventually you'll be able to. Then the hydrosalpinx. Hydrosalpinx basically means that there's a bit of infection in the tube. That's why it's blocked. That's why fluid has collected there. It's a source of infection. It could always spread if your immunity goes down. But as pertains to IVF, if you have hydrosalpinx and we do IVF, the chances that you succeed is low because there's an infection there. Bacteria is producing a lot of chemicals. When we put the embryos there, these chemicals will come and probably destroy the embryo. So it has to be removed before. And removal is surgical. I mean, you can take antibiotics, but it wouldn't solve the problem. Yeah.
A round of applause for our doctors. And to you also for being here. One good thing about all those who are here is that one good thing you're going to benefit is that you have the opportunity to interact with our doctors right after the program and then book your appointment. You don't have to go to the hospital. You can start booking here with them. We will invite Ni Afote Goche II. He is the founder for New Life Nongwa Children's Home. He's also the chief of Otino. Yes, for his message.
Auntie Regina, thank you very much. And I also have to thank my sister for this wonderful program. We have to appreciate her because a lot of women are going through difficult time. I've been a victim of it. It took me 9 years before having my first child. And it wasn't easy. There were a lot of issues here and there. Some say the man is impotent, some say my wife. And I recall the last 3 months before the demise of my father, my wife has another miscarriage. She will take the seed, and every 5 months, something will happen and she will lose the child. So I know how difficult it is. Some try to blame the orphans because they are witches and wizards, and they are responsible for. And some of the people will try to help. Some of them also said a lot of things. I recall one day they said that my wife has put stones in the womb. You know, it is very difficult. Women are going through difficult time. And sometimes, I don't know, but we need to appreciate them and we need to appreciate our sister for this work. It's not easy for women. Some of them are dying silence and they don't have anybody to talk for them. We must also talk to our children. We should see our children as we should make them our friends so that they should be able to talk to us, especially when it comes to sex education and some of these things. For me, I have a lot of boys in my house. So I always try to check their underwear. Especially, I don't encourage them to wear the nylons and etc. And I encourage them to have a free range in the house. When you are in the house, you don't have to put on tight something so that in future it will affect you. I try to educate them about the dangers, and when they see something small, they should come to me so that we rectify it before it's too late. And I also got to know that sometimes some of our lifestyle also affect us. Some of the food we eat, like too much of the snack food and etc., alcohol and etc. But we must also talk to our children so that they won't get involved in some of these things. Because in future, I don't want you to go out there to blame somebody for your own lifestyle. I use what I've been through, what I've seen, and for where we are as a chief, a lot of people come with these issues. Sometimes people come to the orphanage, they want to adopt children. And some of the men will go out there, they will tell you, even though I want to adopt, there are a lot of children I'm supporting already, but I can't sit there to see my generation coming to an end before me. So this issue is very important. And I will plead with everybody sitting here. Maybe you may not have the finance to the money to support them today, but we can save a life. Your 1 CD, your 2 CDs, your 3 CDs will do something. Marriages are collapsing today because of children. We need to do something. We need to support them. And let's forget about this thing is man-made and something. If the children are walking out there, there's no written about man-made or artificial something. Let us support them. If we can put a fund somewhere to support them to do this good work, I think Ghana will be a beautiful place. People will not go to marriage and return back home because they don't have children. They will not work with their husband and do all kinds of things. At the end of the day, somebody will come from nowhere to come and enjoy and leave the woman. A lot of women in the this are doing so many things just to have a child. Some of the men who have women are also not happy. A man came to us, he said, I love my children, my daughters, but I've made money. My fear, a foolish one will come and marry them because of their money. And if you are not very careful, they will kill my children. Not that it doesn't love his daughters, but because of some of these things. So if there is a way to solve this problem, let us all get on board and help our sisters so that they can do a good job, and Ghana will be a better place for us all. Thank you, and God bless you.
Thank you very much. You will all agree with me that today has been a very great session. So soon we have come to an end of our session and would want to thank our partners for making this program a success. We want to thank Tovila Water Solutions. Please, did you see it? Did you receive one? Did you drink? How did it feel? Cool. Very perfect. All right. So please make sure you grab one. Their contacts are on the bottle, and contact them for every program you have. When you call them, they can design beautifully as they have done for us as sponsors. So it's Tovila Water Solutions. They are here. Please make sure you speak with them too. And then we want to thank Accra Fertility Center. They are sharing some flyers. Have you all received? They are very educational materials that you would need for yourself and you going out. So you can pick more and then share with your friends and family. Thank you for supporting us and for Doctor for coming around to be a facilitator for today's session. Samuela Ventures, they are still outside. Please make sure you pick any of their cereal package before you leave. You would want to thank Elapi. Thank you so much for supporting us. And then Clarity Specialist Scan. Thank you. Kenafama has folic acid for all of us here, and the doctors will bear witness the importance of folic acid. So if you are here, before you leave, please make sure you grab the gift from Kenafama for all of us as well. So on this note, on behalf of the director for Xoese Ghana and the board, management, and all volunteers of Xoese Ghana, together with all the people behind the planning, we want to thank you once again for spending your Sunday afternoon, evening with us. As you move into the week, we pray that what you have learned will not only be with you, you share with others. And remember, Xoese Ghana, we believe that it is possible for everyone to have his or her child, and so that we do not stigmatize anyone. Please make sure in your small way you don't stigmatize anyone, and do what to refer others to Xoese Ghana, and we will give them the support that they need. Thank you so much and have a wonderful evening.
Hello, I'm Victoria Autry. I got to know about the program through social media. I saw the flyer on the director of Xoese Ghana's platform, and then I knew it was a great initiative, so I had to join forces and then make the program a successful one. So through the course of the program, I learned a lot, and then something peculiar I learned that's going to stick is that the sperm volume of a man isn't equal to the sperm cell count of a man. And then also one thing I've learned is that in as much as children are a blessing or children are a gift from God, we shouldn't stigmatize couples who face difficulties having children. I would encourage the organizers of Fertility Conference to host a lot of programs, reach out to communities, because a lot of people are facing difficulties, anxieties, and depressions as a result of stigma. Yeah, and then we know people in our communities who face a lot of these issues. So kudos to the organizers and then directors and then all stakeholders. And then I would like to encourage everyone to come on board to make hosting these programs easier. Xoese, you believe?
I got to know about the program through the director of Xoese Ghana, Emilia Ayele. So I saw it on her social media and then I got interested. I've learned something that if couples are not able to conceive, there may be several factors that may be contributing to that. So if you are a couple and then for some reason you've been enshrined and then you still do not have kids, the right thing to do is to see the doctor. See the doctor, go for consultation. That is when you get to know the exact reason behind you not being able to conceive. But then don't stay in your homes and then find certain medications or self-medicate. So find the right help from the right people. And then I also learned that fertility stigma is one of the things that is really worrying people out there. And so if you see somebody who for some reason hasn't conceived, please and please again, not criticize the person. Stigma is not the right way to go. So what you need to do is rather show them love, kindness, and support. That is what you need to do.
I'm Joseph Ajete, and I head of Fertility Conference from the director of Xoese Ghana. And this has been a very, very great conference, and to be precise, an educative one. And I encourage each and everyone, especially the men outside there, to have a feel of this conference. For a while now, I see that fertility stigma has been has been a major problem in our society, which day in and day out is affecting us. So with the help of this program, I think everyone is going to have or is going to know more about this. Please, let's all encourage our families, our friends, our brothers, our sisters to attend this program. And also you can reach out to Xoese Ghana on all our social media platforms. Thank you very much.